Paging Dr. Bot, artificial intelligence has infiltrated every aspect of our lives, so why not healthcare too? We expect doctors to always be right. They often work long hours under intense pressure with limited resources, and that leads to medical mistakes. According to our next guest, each of us will face at least one diagnostic error in our lifetimes, and in the U.S., diagnostic errors cause death or permanent injury to almost 800,000 people a year. So while the human touch may always be part of the healing process, many physicians agree that AI could help.
Medicine is far more algorithmic than doctors are willing to admit. And if your job has an algorithm, even one buried under years of training and nuance, AI is coming for it. That means every specialty is on the table. And I'm not saying this to scare you. I'm saying it because most doctors are still walking around like AI is some far-off sci-fi threat. But it's not. It's already here.
Okay, joining me now to discuss is Charlotte Blease. She's an associate professor at Sweden's Uppsala University, and she's the author of a new book, Dr. Bot, Why Doctors Can Fail Us and How AI Could Save Lives. So we were just talking about the pressure on doctors and the fact that there are still a lot of errors and a lot of misdiagnoses. Lots of women talk about that as well. What are the ways AI could deal with that diagnosis issue?
So thinking first about the problems, AI could help solve some of the problems here. And there are very human problems with medicine. For example, keeping up to date with information. I made a calculation a couple of years ago. There's a new biomedical article published every 39 seconds. If doctors were to read 2% of these, it would take them 22 hours per day.
So doctors would have to read 22 hours a day of medical research just to be up to date, never mind just basic knowledge.
Yes, and this is where AI could help because it can crunch through information at breakneck speed. That doesn't mean to say that AI is without problems, but the key issue here is who or what could do a better job of delivering healthcare. And when we think about that question, we need to think about it in terms of different tasks. Diagnosis is one, gathering information from patients is another one. Patients pour their hearts out to machines, and that can be a good thing because they give more information away.
But it can be a bad thing. You were talking that we self-censor with human doctors sometimes, right? We're embarrassed to explain certain things, and that would be different, or people at least, we know, speak differently to chatbots.
We've known this since the 1960s. Sort of as early as putting a patient in front of a computer, there's been recognition that patients say more. They don't save face. 85% of Americans admit to lying or massaging the truth with their doctor. Why? Because they're sitting in front of a comparatively high status individual and they're worried about embarrassment. They don't want to be judged. And also they don't want to ask too many questions of their doctor because they don't want to appear stupid.
Yeah, they're intimidated.
Yes.
This leads me to the flip side. Already we have heard of people falling into real trouble mental health-wise with chatbots. Some of it has to do with the fact that it kind of confirms the thing you're already saying, and it feels like in the diagnosis space there would be danger of that.
I think there's real challenges here. I mean, my book isn't a love letter to technology either. We've got to consider the fact that AI can be people-pleasing, it can be obsequious, there's a whole cluster of biases that can persist. And the opportunity here, however, is to see if we can it's very hard to de-bias people, particularly in frenetic environments. And it's also hard to spot bias, for example, in yourself.
Yeah.
We're always better at spotting it in other people. This is where there could be an opportunity with technology but we have to work hard at that to see if we can find ways to de-bias these tools to reduce inequality in healthcare. But that's a very big concern, and it's going to be a big demand.
So before I consult Dr. AI instead of Dr. Google, which I can tell my doctor really loves that I do, what has been the response from physicians as they're hearing about your book?
So far, they have been positive because what I'm doing in this book is to recognize the challenges that doctors face. Of all experts, I think they have the most colossal knowledge demands placed on their shoulders. And my research shows they're already using tools like ChatGPT in staggering numbers.
So they're already using the technology. You're just saying there should be, what, guardrails and formalize the process?
Absolutely, and I think we need more civic conversation. We need more conversations like this, because ultimately, if we want to use these tools, we have to decide, who do we want our healthcare providers to be? Do we want it to be Google or Meta or Amazon? These are societal and political issues that we need to confront, and I argue it's unforgivable to delay those sorts of conversations. We need to be having them now.
Well, thank you so much for bringing them to us, Charlotte Blease. You can read her book now. It's called Dr. Bot: Why Doctors Can Fail Us and How AI Could Save Lives.